So thank you again, everybody, for coming. And I'm really excited about, again, it is, spring has started. The days are getting a little bit longer. They're getting a little bit warmer. And the importance of nature and the healing properties, something that I feel in my bones is so important. And that's what our guest speaker is here to talk to us about, and amazing research that he's part of. Gibran, do you want to introduce yourself?
I'd be happy to. And while I'm doing that, I realized that I didn't realize I couldn't do the share my screen from from the web-based version, and so I'm just in the process of downloading. So I might have to let me log off and log back on. I'm sorry.
Hi, Gibran. I'm sorry, I'm just joining. Do you want to send me the PowerPoint and I can try to share it?
I just need to log off and log back in, I think.
Okay.
Let me switch to desktop app. Oh, okay.
Hey, Lisa.
So my name is Gibran Mancus. I'm assistant professor at the University of New Hampshire. Previously, I was at the University of Alabama. Some of my work is there. Sorry, are you guys able to hear me?
Yes.
Okay, cool. So I am, I've always loved trees. I've always loved being in nature. To me, there's nothing better. I remember climbing trees as a child, and I never thought I would get to study nature, as part of nursing even. I remember when I first started talking about trees in my doctoral program, I'd get a lot of, kind of inquisitive looks. And when I did, and what happened was, though, everybody started including greenness in their studies. And it was kind of fun. It was really fun. Sorry, it's making me log off. Give me 1 second. It's making me log off real quick. So I'll be right back.
Okay, well, in the meantime, if people want to put their email address, their name and email address in the chat box, then I will be sure to use that to send out your evaluations for the program, and then Hannah will send out the contact hours to you. And again, for those that are late attending or missed my PSA for our April call, Dr. Barbara Sattler is going to be here and talk about food and agriculture. And we will also hopefully be able to provide, I'm anticipating being able to provide contact hours for that as well. We're really lucky. If any of you are doing any kind of research or something that you think that you could do a presentation in our work group, we would love to have you. We would love to be able to hear about new work that you're doing, projects within your school. We had Shanda Demarest come a couple of months ago and talk about the climate change project, so that if there's projects that you wanted to highlight at your school, this would be a really great opportunity. We are looking for, we're planning for May. We have April planned. We're planning for May. And then we'll talk about probably in April or May what we're going to be doing over the summer, because as true academics, we need a little bit of a breather after the semester is over, but we don't want to lose the momentum that we've had. So please reach out to to myself or Jen Wasco as far as presenting. I see your PowerPoint. So I think are you ready to go?
Yes, I'm so sorry. Thank you for your patience.
No. This is perfect. I'm glad you were able to get this ready and show it for everybody. It's all yours. So
Thank
you
you.
were
Thank you.
introducing
You know,
yourself.
you mentioned climate change, and I really feel like this is like, to me, it's all using a planetary health lens. We are living in this beautiful ecosystem that is stressed, and we are stressed. And when, you know, I think sort of, I was mentioning earlier, I was like, you know, I loved climbing trees because it was a place where I felt home. I felt home climbing in the tree, holding on to and hugging a tree. It was bonding. It was connecting. And I think that's one of the greatest values of it. Well, one of the many values of nature therapy is being able to make connections beyond yourself, both to the many diverse species within our ecosystem, but also to each other, because trees, they create canopy, it creates space where we can come together. So just a couple objectives. We're going to talk about health benefits of engagement in nature, and then we're going to talk about a project that we're doing right now that involves nature and health. So I did my dissertation in Baltimore, and we were looking at cortisol levels amongst people in different neighborhoods. Well, we looked at cortisol and dehydroepiandrosterone as sort of, and the ratio of those two sort of the marker of physiological resilience. And these are street views that I took during my dissertation, and it's just so very contrasting that this is Baltimore in both pictures. And it's just such a different feel. So you've got, you know, in the upper picture, down in the distance, there's like a tree and it kind of looks lonely. But you know, other than that, there's really no vegetation on this street. And then on the bottom picture, you've got, you know, trees and grass and bushes, and it's a very different feel, just visually. But then when, you know, you step into the picture and you step into the real world, it becomes multidimensional, and we'll talk more about that. But there's been a good bit of sort of evidence looking at greenness from satellite view, and I'll describe that more in a minute. But you know, we've found an inverse association between the level of greenness and depression. There's a positive association between social interaction and resilience in a number of different ways, both physiologically, in this particular, in the Agorov study, they're looking at physiological resilience. We've also found, some colleagues and I, we did a study in 2021 that looked at cortisol levels, and we found that 22 minutes in a park resulted in a significant decrease in cortisol levels. There's some theoretical work out there regarding oxytocin, and that's part of what we're going to be doing in our current study, is actually looking at oxytocin as one of the measures. But there's some theoretical work out there that says nature exposure supports oxytocin levels. So population level, this is a map that we made of Alabama looking at greenness. So this is one way to measure, you know, nature exposure. It's sort of it's a proxy. You've got, using satellites, you can look at the near infrared and visible red light, and you can compare it. And you've got higher reflection of near infrared and less reflection of visible red when you look at places where there's more greenness. And then visible becomes higher and near infrared becomes lower in the reflection that you get from, for example, Landsat satellite. So that's what we did in this study to create this map here on the right. And that's both known as enhanced vegetation index, which kind of accounts for vapor barrier, but also there's normalized vegetation index, which is a little bit rougher of an estimate. But that's one way that a lot of people have looked at different factors when it comes to health. We looked at, we did a comparison of each of the block groups in Alabama and mental health. So we think about what's happening when we're in nature. Well, there's a whole bunch of ways that we're sort of interacting with that space. We primarily through our senses. One way to think about it, you've got there's the sense of smell. So this includes things like phenols, the chemical messengers that trees release, if you've been in a pine forest on a warm, hot, sunny day, and you get that aroma of the pine forest, right? That can have physiological effects, but it certainly has a psychological effect depending on your interpretation of that. When it comes to sight, we can see the leaves moving in the breeze. We can see the tops of the trees swaying. We can see the water moving. We could hear birds. We can hear the birds in the trees. We can hear the wind blowing through the leaves and making that rustling noise. We can taste. Taste and smell are so very close. But also, we can physically, we can actually taste some blueberries. We can taste some mushrooms. We can, I'm not saying you necessarily want to do it, but you could taste the dirt, right? Like, there's that potential. Sometimes we can taste things on our tongue, even through the air. That differentiates between smell and taste gets a little gray. Touch, we can touch the tree, we can touch the moss, we can walk barefoot through the woods, through the leaves, through the grass. Now, we often think about five senses. There's some growing research looking at sort of more thinking about senses in a more complex way. Vestibular being sort of the sensory system that contributes to balance in the sense of spatial orientation. This can be through mindful movement, right? Thinking about where we are in space and time. And then interoception is sort of the signals from your body, like when you're hungry, when your heart is beating fast, or when you need to use a toilet. Is there something different depending on the space that we're in? If we're in nature space, is that changing? And there's some evidence would suggest, things like heart rate variability. And it's all these things sort of acting in synergistic ways. And then also there's with proprioception, the sense of self-movement, force, and body position. All these things are feeding into, and including sight, smell, taste, hearing, taste, and touch, into emotional regulation is some of the theory behind it. So how does this work? One theory is through this idea of engagement. So for passive engagement, that is that idea of you're in the forest and you hear those sounds that we talked about, the birds, the wind, you see the sights, you smell. It's engaging. It's telling we're sensing that there's nothing to fear. We're sensing that all is well. And so that those sensory information that's coming in is cueing our body in a passive way. It's engaging us, but in a passive way. It's not an active engagement, which engages the fight or flight nervous system, the sympathetic nervous system, where we spend more time in that parasympathetic space, we tend to have more resilience to potential stressors. If we're always in that parasympathetic space, we risk chronic hyperarousal. What does that look like, sort of from a low resilience or a high resilience standpoint? If we look on the right, the person who has chronic hyperarousal, they have a sort of a smaller well. I don't know if you can see my mouse, but there's this well here that active engagement is trying to kick us out of. It's trying to kick us into sort of a even higher aroused state, more sympathetic activity, more endocrine engagement to sort of try and get us back to a more homeostasis. Whereas somebody who has more resilience, they have this deeper well they can draw upon. And the passive and active engagement are sort of trying to keep us, well, the passive engagement sort of keeping us in that lower arousal state, whereas active engagement is trying to kick us up into a hyperarousal, which is good, right? We see the bear in the woods, to use that analogy, that's okay, all right, I need to make some decisions sort of quickly, right? But if that bear is living on your front porch, or coming home every day, or there's a lot of bears in your neighborhood, potentially that could put you in that chronic hyperarousal state. Just sort of highlighting what we found in that park visit study. We did a pre-test, post-test. We measured cortisol, dehydroepiandrosterone, the ratio of cortisol, dehydroepiandrosterone, and then subjective well-being. The significant findings we found were mostly around the subjective well-being, the cortisol, and we saw both of them went, the subjective well-being increased, cortisol levels decreased. DHEA there was a decrease, but we sort of anticipate that because DHEA responds to the cortisol level. And so when the cortisol level goes down, we don't need as much. And so that's why that ratio is sort of more telling. And we saw the ratio get smaller, which we would anticipate, but that wasn't significant. So why am I doing the work that I'm doing right now? I feel like maybe some of you can empathize with this, a sort of post-pandemic stress disorder. We've got a lot of worries. I put post in parentheses because, well, we're not necessarily maybe it's not not post yet, but for the big picture, we're starting to see the challenges. A lot of worry, not necessarily specifically about the pandemic, but I think in life in general, loneliness, fear of a lot of different things, and then fatigue, both physical and mental, lack of sleep, and then sort of that coming back to that theory, that passive engagement. Some of it, what we understand is that it helps us to reduce mental fatigue. When we have passive engagement, it allows us to respond differently to what we might see as an aggression. Instead of interpreting it as an aggression, we might say, oh, this is a problem, but maybe there's like some sort of opportunity in it. Whereas I might respond more aggressively if I don't have, if mentally I'm fatigued, I don't have the capacity to deal with it in a positive way. So that's sort of what's driving me. I see that in my students, I see that in the community, I see that in myself. And so we were like, how can we do something about this? So we came up with a study. We're calling it Immersion in the Woods, a study of the impact of forest medicine on the biopsychological measures of stress response. And it's a randomized trial. We have a pre-post test of physiological and psychological markers of health. The intervention is to go spend time in College Woods. That's a picture up on the right. And then the other is to sit on a chair facing on the quad, which is still a very lovely green space, but also facing a main street. There's a lot more activity. It's not a natural space. It's a very maintained space. And there is some, you can have some debate about natural spaces in our world today. There's, one might say that Yosemite National Forest is probably one of the most maintained spaces in the world, and an abandoned lot in or that what was it, the elevated track in New York City that sort of like rewilded itself. It's just like all this earth and seeds and things started growing on top of this like old abandoned railroad track, and then they turned it to a park. The High Line, yes, thank you, exactly. That's that might be, before they turned it into a park, it might have been like a super wild space. But again, it's when I think about nature, it's very different than often gardens, because gardens are often planted in rows, whereas nature tends to plant, to appear in spirals, following the golden rule. And there may be something, we don't fully understand, but that may be one of the mechanisms that is encouraging or affecting our psychology. This, looking at a flat surface, a square surface, does that change the way we respond when we're looking at, something that's a curve? Getting back to those sensory inputs. So we are measuring some biomarkers, and we're doing some psychometric tests. The biomarkers, it's a passive drool for the salivary cortisol and for the oxytocin. So salivary cortisol, that's measuring, getting at fight or flight. That's getting at that reaction to potential stressors. What might that look like in a built environment? Well, it might be a siren, it might be a sidewalk, right? Sidewalks, oh, it's got like, there's like cracks in the sidewalk. There's you could, if you fall on concrete, it's going to hurt a lot worse than if you fall on like a grassy knoll, or a mossy forest floor, right? So that engagement, that active engagement. So creating, potentially engaging the fight or flight response in the body. So we're looking at that through salivary cortisol. We're looking at the perceived stress scale to understand stress, and we're looking at the positive and negative affect, both to get to distress, but also joy, right? We're measuring, joy to get at calming connection, that calming connection of that we could potentially have. So that's psychometric, the joy with the positive and negative affect scale, and then also looking at attention restoration through the perceived attention restoration tool. This ability of or changes in our ability to respond to stressful situations, but also to feel connected. And then biologically, we're measuring parasympathetic activity through the heart rate variability, which is, we're going to be using portable ECG monitors, and they tell us a little bit about variability in the heart rate. And variability is a positive thing. When we breathe in a more relaxed state, there tends to be more variability in our heart rate. There's some evidence that would suggest that the more variability, the more resilient you are to stressful situations. And we think about the heart rate as being sort of consistent, but ideally it's almost more melodic. It fluctuates. It speeds up and slows down as we breathe and as we breathe in and breathe out. And the more variability, more indicator of potential a stronger disposition to respond to stress. And then also measuring the oxytogenic system, getting to some endocrine response, salivary oxytocin is what we're measuring, and oxytocin has been it's been shown to have analgesic effects. It reduces anxiety. It is the bonding, and so we hypothesize that we can bond with more than just humans. We can bond with nature, and that's sort of being a big piece of not only feeling less lonely and feeling connected, and potential health benefits for that, but also again, kind of coming full circle as to what you guys were talking about right before we got started, is caring about the nature enough to do something about it and to be engaged in work to help take care of the environment. So we're going to do a little bit of analysis looking at how likely that there's a change in the distribution between the two groups primarily, and then within the college woods, the heart rate variability, it's a lot of data and it fluctuates. So we're going to have a lot of measures with that. So we're going to be using repeated measures, analysis of variance for that. Thank you for your time. I feel like I went fast and sort of superficial at the same time. But I'd love to hear questions, and I know I saw some things pop up in the chat.
I have a question. Could you provide some more information about the perceived attention restoration tool?
Yes. So it came out of it came out of the outdoor recreation therapy, really. I mean, that's sort of the heart of it. And it gets to this idea of mental fatigue. It's this idea that being in nature, being in outdoor spaces, gives us relief, gives us it alleviates mental fatigue. It helps to decrease that burden on our body, and then allows us to be able to respond to stressful situations with more attention.
How are you going to measure that in your research?
So we're measuring, it's a tool, it's a psychometric tool. We're measuring it before and after. So we're having people, we're hooking them up all of the gear. We'll have them provide a salivary sample. We're having them take a survey. We're taking them out into the woods or onto the quad. We're going to have them sit there for 15 minutes. And then we're going to bring them back in, take everything off, and be able to look at pre-post, and then also continuous data with the heart rate variability. So we're hoping to triangulate the different effects. Ultimately, the goal of this is to develop specific interventions so that we can actually take people who have trauma or stress and anxiety and depression and give them experiences, provide them with opportunities to have these therapeutic experiences, plus encourage people to do it.
And I have one other question. Have you had people who are afraid of going into the woods? Because I think back to something that Dr. Sattler had talked about. I don't know if you had run into her, because she was in Baltimore as well, and now is in California. But she was talking about how there's so little green spaces and woods and those kinds of things that a lot of parents, I'll say, instill fear to the children of, don't go into the woods because it's dark, we don't know what's there, those kinds of things. And I was wondering if you would come across that in your research, and would you include them in your study? Would you help them overcome their fears? Or would you just use them in your, I don't know, that would be just terrible data. But anyways.
No, I think, it would be good data, right? Because we do also at some point want to add a qualitative component. So historically, there has been this common wisdom that woods are dangerous places. And it goes all the way back to like medieval times when everybody was required to cut their woods 50 feet on either side of roads. The police have often used that as a mechanism of they still encourage like the line of sight. They want to be able to see far. And there's evidence that suggests crime is lower in neighborhoods that have more greenness and more trees and plants. And so, and more community cohesion, again, because it creates that canopy. Now, grass and bushes tend to be sort of neutral, but like an intact forest, you still have a lot of line of sight. Which, you know, a healthy forest is very different than like, you know, I remember being in Baltimore and there's overgrowth and it's filled with trash and all of that has a very different signal psychologically. So there is something about a healthy intact forest where you do still have line of sight. You have the overhead tree canopy, which is very different than, you know, kind of, and so that's the challenge, but also qualitatively. And can we facilitate for that people? Can we take them into healthy forests in a therapeutic setting that would help people who A, have that fear, but also B, have that trauma and anxiety and depression.
It sounds really interesting.
Here,
Tom, you have a
I think
question?
Heidi has her hand up.
Oh, thanks. Hey, Gibran, I'm Heidi Rogers. I'm so excited that you're doing this work. I just Googled you. I'm thrilled. Thank you so much for presenting on this. There is a group of nurses who are pulling together around doing more nursing research on forest therapy through the Holistic Nursing Association and others. And I think it would be really neat to have this intersection of these environmental health nurses really trying to think about what's the bigger body of research. How can we use this research to really advance preservation of nature spaces, those kinds of things. And so I'm going to put my email in the chat. I'd be happy to organize us into a little meeting and then be a connector if folks would just send me if there's anything that's interesting, because we've already got like a group of folks that are doing this, and I'll bet you do too, Gibran. So thank you. Thanks for letting me advance us into a collaborative.
Thank you, Heidi.
I was going to say, Heidi, I'm very excited because I'm having Roberta Levin come and talk at the University of Pittsburgh.
Yeah, that's cool. Roberta is one of my colleagues at the University of New Mexico. We're doing some planetary health and integrating that into her stuff. I got certified as an ANFT, I'm a certified forest therapy guide. And we just published a study on like burned out health professionals. We took a bunch of folks out that were burned out to the woods at UNM just last spring and just published it in the summer.
Okay, well, I may be in touch because we're doing an endowment series. So
yeah, sweet.
And
nice to see you, Jennifer. I know we've crossed paths a couple
Gibran.
times, as have we all. But anyway, yeah, yay!
Great, thank you.
Heidi, what were your findings of this study? I'm hoping it was helpful to the burned out health professionals.
Yeah, you'd think. No, you know what? It wasn't. We need to change our systems. Our systems are toxic. Everybody felt great after going out, and then they went back to work and they felt bad again. So, you know, we had a lot of conflicts in the study design with the funders. We got internal funding, and they were like, we need you to move the needle on professional burnout. And we were like, this isn't going to work, which we then proved like it doesn't help with professional burnout. But what was cool is that we got a chance to take a bunch of faculty and residents out on these forest therapy walks. And now we're talking about actually funding that as a service for our students. So I'll put a link to the article in the chat. And I'm super happy to talk to anybody about it. Also, I'm working with Maggie Hansen on like a new updated systematic lit review. If anybody wants to join, you can, if you're looking to read a lot of forest therapy literature with a bunch of nurses, let me know. I'd be happy to include you.
But Heidi, I agree. I did a study. It was called, and I pulled it up, Nurturing Wellness and Self-Care with Graduate Sustainability Students, Escaping from Stress and Anxiety with the Help of Nature. I took them out. We had a nutritious lunch. We had journaling. We kayaked. My findings were bad because they were already sustainability students. They were already doing these practices. So we really couldn't move the Dow on that. So I hear you.
One of the things that there's a book called The Nature Fix, and they sort of make the premise that like there's these needs for daily doses, more in-depth regular doses. If we think about 20 minutes a week, right? You have 20 minutes a week or 20 minutes a day every day. It's like a couple of hours every weekend. That's a couple, maybe a weekend a month, or like a big immersion once a week, or or like a week long for once a year. And the people who need it most are those who don't have access, right? And that's sort of the big, that's also a big part of, the importance of doing the epidemiological studies, is like who's at most risk when you have people who don't have the option of going to a house in the woods or a park, or they don't live right next to a park. So yeah.
Thank you for being on the planet, Gibran. It's so exciting, the work you're doing. Thank you.
Thank you.
Tom, did you have a question?
Yeah, thanks, Gibran. I live in Oregon, and I suppose I'm probably in the 10%, not the 1%, but the 10%. So this kind of stuff is easy for me. But I have a niece who lives in New York City. He's got a 3-year-old daughter, and I suspect that daughter's never looked up and seen the stars, and's probably never seen the horizon. And I hear them talk about seeing a tree, and all I can do is kind of smile from my perspective. So I'm curious what you think are going to be the policy implications, given that, 80% of the world lives in cities. So how is this going to work for the other 9 billion people, and particularly people who don't have means and wealth and cars to get out to the woods and all that kind of stuff. So what are you thinking in that area?
I remember living in Yonkers, which is not New York, but Yonkers is I used to call it the other borough. It's up against the Bronx. And I would ride the subway into Manhattan to go teach in downtown in the financial district. And as soon as I got off the subway, I found the biggest tree I could find every day and would give it a hug. Because I was just, energetically, like, I just needed to let go, right? And New York only exists because of Central Park. I think New York would implode if it wasn't for Central Park. And it, Morningside Park, and you have these parks, right? And yes, it takes people out of their time, but it becomes an issue of policy, right? Like maybe we, moving to a 4-day work weekend or a 4-day work week, so people have 3 days to go get away. And how do they get away? Building in the same way that we prescribed food for people who are malnourished, maybe people who are suffering from nature deficit, we prescribe, not just prescribe, but give them access to getting into those spaces. And building in as much nature as we can to places and have laws that restrict, Boulder, Colorado. I remember you cannot build anything in Boulder, Colorado without increasing open space. So if you want to build something new, you can build something new. It has to be smaller and has to be and has to create more open space. Like that's a policy.
Let me push back just a little bit. So I do get that as an individual can make these decisions, and I do get that as a provider you can in effect write a prescription for these kind of things, but there must be metrics that describe sort of how much open space per square mile per population or something like that that can then drive the planning people. So have you seen that kind of work and those kind of metrics? I mean, we got like Boulder, we have a city in Oregon, Eugene, Oregon, where it's a granola and sprout center, and so of course it's true there, but so what about metrics on?
I know the metrics on access, like people of color and people in poverty have parks that are half the size and serve, I think, 5 times as many people. The Trust for Lands, they've done some analysis looking at that. Can we turn buildings green? Can we green roofs, green walls, green streets? Like, okay, we can't, how many streets do we need? Like when we move, as we move away from a car society, can we turn the streets into parks? What are the benefits, potential benefits of that? Preventing runoff, preventing, and increasing access. That just that's how, I mean, that's pie in the sky, but I think that's what we have to do. I think we have to visualize, making sure everybody has access. And then, create programs where people can go get an immersive experience, where they can go see the stars, where they can go be in, an old growth forest and take their shoes off and have that experience. Even, once a year. Maybe they can't go for a week, right? Like, I mean, I think Korea, they've really done a lot of like building in pathways for people to be able to get to spaces like that.
Thank you. There's a couple other hands up. Debbie and then Catherine. Debbie, you have a question?
Yes, thanks. I'm Debbie Hogan. I'm from Florida. So because of our weather and sunshine, we do have a lot more friendly nature here. But I guess my question, based on all this discussion, is how much, and I put this in the chat too, how much, based on your research, of this area do you really need? I mean, you just alluded to it. Maybe we can encourage people to build, but does it take a lot? Does it take the whole woods to walk through for somebody to get that sense? Or just the fact that you can build an area where somebody can come, sit, see the trees, and then, leave and go back home? So do we need a lot so they can immerse themselves, or can we at least expose them to something even smaller, but give them that positive sense?
I think it's all of the above. I think you have to have, I think you need that daily dose. I think like that, you remember the picture of like the street that had no trees on it? Like, we could change that. Do we need that much concrete in a space? Like, can we put in some trees? Can we put in micro gardens? Can we put in, I think there was a project in New York actually where they were like around fire hydrants where you can't park anyway. They were tearing up the concrete and they were putting in micro gardens. And the fire department didn't care because they could put the hose through the micro garden and still get to the hydrant. But it was just wasted space. Nobody could park there. It was just asphalt and concrete, right? So they were making these micro gardens, and it helped with preventing water runoff, and then allowed people to have access to nature spaces. But I do think it's all the above. I think it's, as you're walking home, having streets, trees along your street. I think it's if you, and then, if you don't have, a park for a street, it's, having a park within proximity, somewhere you can go. There's a program, it's, TK Foundation, I want to say. They used to make pickles, and they take pickle barrels and they make benches, and they build these micro parks, and they plant trees in a circle. There's two, and I know in Baltimore, but there are other cities as well. It's transformative to walk from a street into what was, like, for example, one of them was an empty lot. And it's transformative to walk from the street a couple of feet into a grove of trees and sit down. My personal experience, it is transformative to go into that space. It can be a micro park. It can be, it doesn't have to be big, but like having, all of those levels. Yeah, I think it's great. I think everybody should have the opportunity to go, bliss in the woods, as part of a therapeutic opportunity if they've never had that experience, so that they are prepared for it mentally and psychologically.
You go ahead. I can reheat mine. You go ahead. I'll be right out. I should be done.
Okay, Catherine.
Hi, what great research you're doing. It's wonderful. And I wanted to just add a couple of other senses. The the mirror sense, our mirror neurons. They don't just mirror our expressions and smiles when we see someone, they actually mirror what's happening in nature. And the imaginal sense. So when you think, which speaks to creativity, when you think about even and I'm thinking of a kid in New York City, there must be birds in New York City, but maybe not. I don't really know. But when a child sees a bird, or when I see a bird fly up, those are stimulating my mirror neurons of wanting to be free, of wanting to fly. And that is in and of itself a parasympathetic nervous system stimulator. And then the idea of imagining, the sense of imagination, and when you go back and look at some of the early artists that we've seen, and current artists, think of Van Gogh's Starry Night. I mean, he was being inspired and imagining, and he was outdoors looking at the stars. So I think that, and kids are especially good at that. I did want to say that in San Francisco, where I've spent most of my life, we do have codes that say for every square foot of development or building, you have to put in equal amounts of open space. And I don't think that, I think that it doesn't have to be a forest. It doesn't have to be a tree. It can be, a plant in a barrel, but just exposing people and patients to that. When you look at the early Persian hospitals had patios in the middle, and they had fountains and trees, and they had beauty and paintings on the walls. And this is not a new concept. We just have to return to our early roots and really look at what other cultures have done. So this is great work. And then lastly, the heart sense, that sense of each time we go see a new thing in nature, it touches our heart, and we all can say, I know from my heart that this is making a difference. I'm glad that we're doing the research to prove that it makes a difference. But I think as nurses, like many things, we have intuitively trusted our heart that it makes a difference. So thank you for proving it in a positivist manner. But thank you also to the holistic nurses who have always known it's true and shared it with us. Thanks.
When I was in nursing school, I went to a conference, and there was somebody from the Emergency Medical Association who got up and said, if you want to be an emergency room nurse, which at the time I was thinking about it, he said, you have to be able to work 12 hours without going to the bathroom, without drinking water, without stopping to take a break. And then somebody from the Alliance of Nurses the American Holistic Nurses Association got up. She says, well, I'm also a nurse. I'm also an emergency room nurse. And in my nursing room, we make sure everybody goes out and gets fresh air. We make sure everybody goes out and drinks water, goes to the bathroom, eats food. And so, yeah, I mean, like the burnout that somebody mentioned earlier when, you know, they were talking about the study that, you know, the burnout, we do have to change culture and then make it more accessible, like you said, like having that pavilion, that space within a hospital that allows people access. I worked at a behavioral health hospital when I first graduated, and every day I would go, no matter the weather, I would go outside. And I would try to get the patients outside too, you know, and that wasn't always possible, but at least myself, so that I could reground and have that experience. I would eat my lunch outside in no matter the weather, in Nebraska, just to like be outside in a 12-hour shift for at least half an hour.
You make me think about when I was in nursing school, I worked at an extended care facility, and I decided that it would be a good idea to bring my patients outside for a walk until one of them escaped and I got into trouble. There's one more question in the chat that said, would you speak to the intersection of homelessness and nature therapy?
So that's really interesting on a number of levels. So one of the things we found qualitatively in our study in Baltimore was there was substance use in the park. And I'm not drawing a correlation between substance use and homelessness, but allow me to get there. There was somebody was talking about, you know, substance use in parks, and they asked me what I thought about it when we with the finding, because we didn't, you know, it was just one person sort of, you know, at least one person mentioned it. But like where if substance use is associated with trauma, and where is the most peaceful place in a city? It's probably a park. If you're seeking solace, if you're seeking restoration, if you're seeking to reduce those feelings, where better than in a park? And where do a lot of times we do find people who do not have housing, who would, if they could choose, live in a park, but are often not allowed to. So they find themselves under underpasses. They find them anywhere that nobody else wants to be. And when they are in those spaces, you know, it can affect perception, right? So perception of safety is really is an important factor in people's uses of parks. People don't want to use parks if they don't think that they're maintained. So there's sort of like competing interests. Who's the most vulnerable and he needs it the most? Probably the people who don't have a home, who also will benefit from it. You know, when you have a park that's, you know, so small that, you know, you are competing for resources. Like if you have a really large park, if you have a really large forest, if you have a really large space, you could probably have a number of homeless people there and nobody would even notice. But when it's smaller, when it's serving more people, then it becomes competition for space. And, you know, I'm not sure if I'm getting to your question, but I think, you know, it tends to be warmer in the winter. It tends to be warmer in parks because there's biomass and there's wind protection. And in the summer, it's cooler versus being on on a concrete street, or being, you know, surrounded by concrete. It's colder in the winter and it's hotter in the summer because of heat island effect. So maybe I didn't even fully understand your question, but I guess I had a lot of thoughts about it.
It wasn't my question. It was from the chat. I don't know if anybody wants to add a follow-up to that or any other question. We're almost out of time. I just want to make sure that, you know, we engage with this great topic as much as possible. This has been fabulous. Catherine, I see your hand.
Kathy. Catherine.
I just like to say that the earlier talk about taking people out once or twice, you know, it takes a long time. It's taken a long time for us to create the roadways in our brain that go directly to cortisol. And it's so easy to stimulate them. And it's going to take us a long time to go back and use our neuroplasticity to create new pathways. So we need to go out in nature more than once. We need to be quiet for, I think they're saying 12 minutes a day, but one time isn't going to cut it. So set those goals for 12 minutes a day. I'm doing that and flossing my teeth every day and feeling better about life.
There was one question in the comment that I noticed that was about the oxytocin and what it's a messy hormone, but I think it's really important. I think my understanding is you don't necessarily have elevated levels, but you get boosts, and those boosts I think have longer term effects than just the one time, right? Like they sort of it's you don't necessarily have sustained cortisol levels, but you get that boost from that bonding experience, you get that boost from that connection, and that in and of itself I think makes changes that have more sustained effects. But again, it's a messy hormone, but so is love.
Can you guys hear me?
Yes.
I posted a question about the intersection of homelessness and nature therapy, and I guess my follow-up, kind of following on what Catherine said about the 12 minutes. I mean, I guess there's a time limit, like any medicine, like overdosing. You could be outside for so long that it actually impacts your health in a negative way. So is there like a safe dosing recommendation for this kind of therapy?
So I think it's a valid point. We think about everything having a dose response, right? And so like we come back to the person who is homeless, the person who has houseless, they're outside all the time. And if it's really extreme cold weather or really hot weather, that dose response is they're gonna max that out. They're gonna end up with like people who have to work outside, people who are tending to the gardens. As we have climate change, they're getting they're potentially getting past those safe zones, right? 22 minutes, we found 22 minutes was associated with a significant decrease in cortisol. Cortisol tends to be pretty flat throughout the day, but hydration, right? Like it's meeting those basic physiological needs, right? And one of them being shelter, right? Because we are fairly vulnerable species. We do need shelter. We can't be out in